Dr. Sally Shaywitz, one of the pioneers of dyslexia research, says the only caliber of science that parents should be looking for a dyslexia program is the program vetted by randomized controlled trials. There's not a single OG-based program that has any randomized controlled trials. The Now Foundations program that the Now company brought to market 11 years ago, we brought it to market because we did 3 5-year randomized controlled trials, one on remediation, one on prevention, and one on remediation of fluency deficits in elementary school kids. And then we did randomized controlled trials on stroke rehab. There is no other dyslexia program that meets the standard that Sally Shaywitz says every dyslexia program must be meeting the medical grade caliber of proof of efficacy, which means does it work? And so many parents don't understand that, and many parents don't understand that the Department of Education at the federal and state level is using the word evidence-based, but they changed the definition. And that's why Sally Shaywitz, more than 10 years ago, testified to Congress to say the real definition of evidence-based is, was it vetted by a randomized controlled trial? The educational definition of evidence-based is, do a group of people think it works? Well, then it's okay. We'll say that it's evidence-based because that's some evidence. In medicine, we call that anecdotal. You don't want a child to be given a medication that's never been tested by randomized controlled trials for safety, for effectiveness, for proper dosage, because that's using your child as a guinea pig. And that's putting your child at risk. And that's unethical. And if a physician does not use penicillin to treat strep throat when there's no reason not to use it, they just think, you know what, I'm a physician. I know chemicals. I've studied the chemicals in antibiotics. I've mixed my own concoction. I think I have a better antibiotic. I want you to try this on your child. And Stephen, what do we call that? We call that we call that medical malpractice. So in the educational field, if physicians did, or any healthcare professional that's required to be evidence-based, if they did the same thing in the medical field that we see happening in education, it would be called educational malpractice, and you'd be at risk of losing your license. So we have to make sure people understand they've changed the definition of the same term. That's not to your benefit. You don't want an evidence-based program that does not have randomized controlled trials, because that is the gold standard that all healthcare subscribes to, because it's the best way to give our children, even our teenagers or adults, the most effective program they can get with the best chance for the best possible outcomes.